And thanks for joining us at our Community Corner today, our Medical Minutes. And today we're talking about breast cancer. And around 240,000 cases of breast cancer are reported in women each year here in the United States. And this month, Breast Cancer Awareness Month, hopes to increase awareness and early prevention. So today we're joined by Dr. Jamin Adai, a breast surgeon with OSF Healthcare. Dr. Adai, thank you for coming in today.
Thank you for having me.
Of course. So let's talk about breast cancer, a very important topic all year long, especially during Breast Cancer Awareness Month. So what is breast cancer and how exactly does it happen?
So the body is actually made up of different cells, and these cells divide when they need to produce more cells. But this is a very orderly, well-organized process. When these cells start dividing out of control, then we call them cancer cells. And when this happens in the breast, then you have breast cancer.
Got it. Okay. And who is most at risk for breast cancer?
So I'll say that anybody at all with breast or anybody who has breast is at risk of breast cancer. Women more so than men. If you take 100 new breast cancer cases, 99 of them will be in women and the other one will be in men. And when you go into the general population, 1 out of 8 women would have breast cancer in their lifetime, and this translates to about 12 to 13%.
That's a lot of women.
That's a lot of women.
That is a lot. And what are the signs and symptoms that people should be looking out for?
Since we started screening with mammograms, we are catching these early and early. So we actually have majority of our patients not having any kind of symptoms at all. The few who do have symptoms come in with either a lump in the breast or a lump in the armpit, or they have nipple changes. Either the nipple is retracted inwards or it's deviated slightly to the side, or there's a rash on the breast, the nipple has some discharge coming from it, or there's like redness. Those are the kind of symptoms that most people come in with. Sometimes a few people will come in with pain. So pain is also a recognized symptom, although it's not the commonest symptom.
Gotcha. Okay. And that's why doctors often stress the importance of checking yourself regularly to know what your breast normally looks like so that you're aware of changes.
That's absolutely correct. Yes.
Gotcha. Okay. And if someone doesn't have family history of breast cancer, can they still be at risk?
Yes, the answer is yes, and the majority of people who develop breast cancer do not have a first-degree relative who has breast cancer. In fact, almost 80% of women that we see do not have a first-degree relative.
Wow.
The minority are those who have breast cancer running in a family. So you really cannot say that because you don't have a family member with breast cancer, you are not at risk.
Got it. Okay. Well, that's important to know. Very important. And OSF St. Francis Medical Center is offering free mammograms. So can you tell us about that?
Yeah, so on the 20th of October, we're offering free mammogram for women who are between the ages of 40 to 64. And anybody at all is welcome, whether you have insurance or not. We're going to cover you. Would want you to actually call the number on your screen to try to get more information and to schedule your appointment, but we also welcome walk-ins.
Okay, that's great. So walk-ins are welcome.
Yes.
And you said ages 40 to
64.
64. Okay. And is that the typical age when someone should be getting mammograms frequently?
That is the typical age, but even beyond that. The reason why I'm saying that is that beyond 64, most people get Medicare. So they are covered, and so they don't have a reason not to have mammograms. But anybody at all is welcome to come for this screening mammogram.
Gotcha. Well, some great information today. Thank you so much, Dr. Adai, for coming in and providing all that information.
Thank you for having me.
Of course. And if you or someone you know would like to join us here in Community Corner, you can head to our website, 25newsnow.com, and go ahead and click on the Community Corner tab and fill out the form there. And of course, as always, we'll take a look at it and we will invite you onto our Community Corner. But for now, we'll be right back. It's 11:25. We'll be back in about 5 minutes with all your celebrity news at 11:30.